All right, and we're live. Hi, everyone.
Hello,
Welcome.
everyone.
So I'm Erin. I'm the marketing coordinator for Rejuvenation Clinics of Australia, and I'm here with our clinician manager, the beautiful Anne-Marie, or Annie for short, and she's going to be answering all of your questions tonight about scar reduction, scar repair. So yeah, and we're really excited. Before we start, because I know it'll take some of you a few minutes to log in, get settled down, I should also mention that tonight is all about education and general information. So what we're presenting tonight, it shouldn't really replace your personalized medical advice. But that being said, we have a lot of really great information to share with you. And I have to thank you guys so much because you've sent through some really great questions. And, you know, we're just so excited to be here. And if anything comes up while we're talking away, please type your questions into the comments and they'll come through. Or you can send them to Trish if you want to be anonymous and she'll post them for you. So yeah, please just keep them coming. Keep the questions coming. Now, before we get started, Annie, do you want to tell us a little bit about your professional background as a dermal clinician?
Yes. Thank you so much for everyone for joining us today. It's Erin and I's first time doing a live Facebook. So give us lots of love, but we're hoping to answer your questions. But a bit of background about me and who I am. My name's Anne-Marie or Annie, as Erin mentioned before. My background, I've been working for Rejuvenation Clinics of Australia for 7 years. My anniversary was last week. It's been a long journey. Well, relatively, but it goes relatively quick, doesn't it? And I absolutely love my job. So my path to where I am at the moment is really I became a dermal therapist and started studying and specializing in medical grade lasers in the aesthetic industry. And my particular passion is making my clients feel not only, feel the most confident, I guess, in themselves as much as possible. So, that's led me to here. My other passion is training and education. So I do support our clinician team here at Rejuvenation Clinics of Australia. So I have a beautiful team of 11 who I'm just so proud of my team and all the knowledge that they share. So I do have a training and education background. And I've always worked in the beauty industry. So in total, for the last 15 years.
Wow.
Long time.
Yeah. And I guess education is such a big part of what you do, making sure all our clinicians have the information they need, making sure that the clients understand as well.
Yeah, education, whether it's our industry or someone else's, it's such a big part of what we do. It's something that we are extremely passionate about because with our particular clients, yes, they come in with a concern, but it's creating that tailored journey for every single client and providing them with the knowledge about, what's happening internally that's reflecting externally. So I think education is the fundamental key of what we do, not only providing a treatment or performing a treatment, it's educating and supporting our clients and their needs.
That's awesome.
Yeah.
So we might get started, speaking of education and sharing information, we might get started with some questions.
Absolutely.
All right, so our first question, whenever you ask anyone what the best scar cream or gel to use is, everyone has a different opinion. What is your expert opinion?
So true.
It is so true. There's so much out there and so many blogs and things to get through.
Yes.
So are any better than the others? And are there any ingredients I should be looking for?
Sure. So there's so many products on the market, and I think as a consumer, it's really hard to understand, what's going to work for you. We tailor it. We look at a couple of different things. So we look at key ingredients first of all. So we use a combination of products. So the first thing that I'd like to mention is antioxidants. So when we think of a scar, we think of putting out the fire or taking out the inflammation in the scar first. So what we're going to do and how we're going to do that is through antioxidants and anti-inflammatories. So there's 3 key ingredients here that I'd always recommend for our clients to look for specifically in the product, which is vitamin A, vitamin B, and vitamin C.
And those are your antioxidants, right?
They are your antioxidants. They are your vitamins. So they're really, really important. And if you would like to know more information, I tend to go on tangents, so I get really excited. So please pull me back in if I talk too much about something. But A, B, and C vitamins is really, really important. A tyrosinase or pigment inhibitor is really important as well. So it prevents hyper stimulation of melanin or pigment in the skin, which can occur from scarring as well. And then we also use a combination, and we'll talk about it a little bit more, of silicone products as well. So that kind of acts as a band-aid over the skin. So to the answer to your question, there's a combination of products. So vitamins, okay, so antioxidants and anti-inflammatories. You've got a pigment inhibitor serum as well. You've got a silicone cream and also a collagen product. And we'll dig down into that a little bit further in some of the questions.
Okay, awesome. Thank you so much.
Thank you.
So next question. I've heard LED is good to have before surgery to help with the scarring. Should I have it before and after, just before, or just after? And are there any non-surgical treatments that you recommend? Any others?
Sure. Excellent. I'm going to break the question down if that's okay. So first of all, I always advise my clients that LED lights are a great source of healing post-procedure. So it's something that we promote our clients to do, specifically a red light, which helps with healing. LEDs we use, or also commonly known as phototherapy machines, we actually use in combination to a lot of our lasers. So LED is great post-surgery. And we use it with other lasers. The second part of your question is, are there any other non-surgical treatments that you recommend? So this is something we truly do specialize in. We have so many lasers here at Rejuvenation Clinics of Australia. So we have fractional lasers known as CO2 or Fractional. We also then have our newest laser, which is a Pico laser. And that's been in the industry. It's a newer technology in the industry, and that's where we're driving our best results at the present time. So the Pico laser stimulates collagen, and at the end of the day, a scar tissue is actually made of a protein network, which is our collagen. So we want to stimulate new collagen in the dermal layer of the skin to either help flatten or create a different structural integrity to the skin. So Pico treatments we recommend to our clients. Depending on the scar, we generally say one treatment a month, and generally between 6 to 10 treatments depending on the situation of the scar, the history of the scar, and where it's located. The other beneficial part of the Pico laser I'm talking about is, in comparison to our CO2 and Fractionals, less downtime, not as painful, back at work the next day if it's situated on the face, for example, mild redness, and great and quicker results than some of the older modalities.
That's awesome.
So Pico laser the whole way in regards to non-surgical treatments available for scar repair.
I remember we were all really excited when the Pico laser arrived because it had all those benefits that the older ones didn't have.
Yes, so, absolutely.
Now we just got a question through, if we could elaborate, and thank you, Eileen, for your question. Yes. How do things like Pico work on older scars, 3 years old, history of keloids? Sure.
So as we all know, we have so many, and thank you so much, we have so many different types of scars. So keloiding scarring is a type of scar that is usually raised. It can be quite red still. It can be a little bit shiny. in visual as well. So the first thing that we would do is obviously ask you to come into the clinic. Our general protocol is for you to see one of our doctors, such as Dr. Cussell. He generally does an assessment on the keloid first, and we do a cortisone injection. So the cortisone, once again, helps flatten and take down the inflammation of the keloid. Sometimes keloids can still look a little bit cranky, as I like to describe them, because they're quite red still and they're very vascular. So that's step one, is generally a cortisone injection. From then onwards, we then start treating it with things like the Pico laser that we were just talking about. Even in older scars, that's completely fine for us to start using the laser treatment. And also we can possibly incorporate the LED treatments that we were talking about. But cortisone followed by a laser such as the Pico laser as part of the treatment plan is a really good stepping stone.
Awesome. Yeah,
I hope that answers the question.
Keloids are kind of their own type of scar, like you said. They're more
it's just a different form of scar. So every type of scar we can treat slightly differently. So it's upon assessment, but keloiding is something that we do treat on a regular basis, and that's not a problem whatsoever.
Okay, awesome. Now,
thank you.
While we're on the treatment questions, this next one, is dermabrasion good for helping to reduce scars?
Yes.
I've heard of people having fractional laser, but does it really work?
Sure.
And it seems like a lot of pain for minimal reward.
Yeah, absolutely. So fractional lasers and dermabrasions do work on some scar tissues, absolutely. So once again, I'm going to break down this question. So yes, dermabrasion can help reduce scars, and yes, fractional lasers like the CO2 and Fractional that I was talking about before are fractionated, and they do work really well. We do promote still, without getting onto a tangent, a Pico laser, for the reason being is that what's happening here, fractional lasers drive heat and a photothermal response in the skin, whereas our Pico lasers are photoacoustic and cause a vibration in the skin. So they're slightly different. The healing time is also different. So the fractionated lasers have more downtime, more redness, depending on the settings that you do, whereas our photoacoustic or our Pico treatment won't necessarily have the same amount of downtime. So that's why we steer more towards our Pico laser rather than our fractionated. Both are going to give a result, but it depends on downtime, pain threshold, and how quick you want a response.
Okay, awesome. And now, similar question, except going
Kelly will get to your question in a moment, I promise.
Oh, yes. Thanks, Kelly. Oh, that's a good question too. But this question's about an even older scar. So I had a C-section about 10 years ago. What is going to help, or is it too late? It's still quite raised and red. Sure.
So in regards to C-section scars, this is also a type of scar that we do treat on a regular basis. On this person, they had mentioned that I kept thinking it was going to get better, but it's still quite raised and red. So just jumping back to what we were just mentioning before in regards to keloid scarring, when it's an older scar, it's still quite cranky, or that raised redness that we're talking about, come in for a review. First of all, once again, we'd probably check if it's a keloid scar. In this case, once again, I'm not a doctor, but it does sound along those lines of being a keloid. Same protocol, have an assessment, have a look if it's something that we can inject with the cortisone to help take down the aggressiveness and also to flatten slightly. And then we're going to come back in with a Pico laser. Absolutely. You can treat older scars, which kind of links me onto, I'm just going to answer that question in regards to stretch marks. So stretch marks, some people classify a stretch mark as a scar tissue. It is a different type of fibrous tissue. Stretch marks are hard to treat. They are harder than others because generally, if it's an older stretch mark, they're usually that silvery white color. Okay, so it's a little bit harder to treat, but with the Pico laser, once again, it's stimulating that collagen underneath to improve the texture and the volume and the structural integrity of the skin to help create it to be visually and in regards to even tone. So we do treat stretch marks, but once again, we would have an assessment. Is the stretch mark still that little, pink red undertone, or is it more of that silvery white? And then we would tailor the treatment plan or the settings to that client. Because if it's still a little bit pink, we would actually then incorporate a vascular laser to treat the redness. We would treat that first in combination to then treating and promoting more collagen in the area. So I hope that answers your question for you, Kelly.
Okay, and so if the stretch mark is 10 years old, you can still treat it. It just depends on the condition of the scar.
And what type of scar it is. Absolutely.
Okay, awesome. And now going back to another question about product. Have you heard of the Strata Pharma range of products? Strata Med, Strata Derm, Strata Mark. What's your opinion on these silicone-based products?
Sure. The products that we've just mentioned, we actually use in treatment. We use it post-procedure. Erin and I were talking about earlier today that Erin had RF needling with us. She recognized this as one of the products we had applied post-procedure. And absolutely Strata Med or Strata Pharma products or silicone-based gels we definitely do incorporate. The best way for me to describe it, or how I describe it to my clients, is that it's kind of like a protective Band-Aid over the skin. So the silicone helps with preventing any bacteria over the area. It helps calm the area as well, and does support the healing process as well. So absolutely, we know those products. We do use them in treatment. We do actually get our clients to take home a product post Pico or other laser treatments that we have, including
mine. And I remember it felt
treatments.
Really soothing.
Yeah, absolutely. So
nice.
We do incorporate the Strata Pharma products for our clients in combination with those beautiful vital ingredients that I spoke about before, which is your anti-inflammatories and antioxidants, your pigment inhibitor serum, and your collagen peptides. So we use it in combination. But yes, they are also fantastic products to use.
Awesome. And can you give us some hints to help scars, say, immediately after a surgical procedure to help them heal, or maybe even prevent a wound from turning to a scar?
Oh, this is an interesting one. Yeah, absolutely. So helpful hints in regards to cosmetic procedure to heal faster. First of all, I would always follow doctor's procedures. So sometimes I'm sorry if I don't think my husband's listening to this video, but my husband had a surgical scar and he got in trouble from me because, sometimes what happens is that when you visually look at a scar, you think that it's healed, but sometimes internally it's still that healing process. So first of all, always listen to your doctor's post-care, minimize movement to the area. And I keep touching my arm because that's where my husband's scar is. So sorry, everyone. So always follow post-procedure, including products. Please ensure that you also minimize UVA and UVB exposure. So that's probably my biggest tip, is making sure that you're applying sunscreen. I would always suggest to my clients a physical sunscreen versus a chemical, so a zinc base. For the reason being is, as we know, UVA, UVB denatures collagen over time, but it will also prevent vascularity or causing the scar to become a little bit agitated or cranky. So I think that's my biggest tip, is ensuring that, one, following doctor's orders, two, making sure that you have as least sun exposure as possible, and make sure that you wear sunscreen.
That's good advice in general. All the time. Always wear your sunscreen.
Absolutely.
Now, just to add to this, Carolyn's asking, how long after surgery do you have to wait before you have laser treatments?
Yeah, sure. Look, it really depends on the type of surgery. We always start, and I think that's one of our questions. It depends on the type of surgery. However, we do incorporate nearly quite quickly post-surgery, so even 2 to 4 weeks to come in for an LED. So that start that healing process. through a light source first. From then onwards, and obviously this is after doctor's clearance depending on the type of surgery you're having, once again. So starting with an LED or a phototherapy treatment is a good starting process, and then we would probably start incorporating laser between 3 to 6 months post-procedure. But once again, it depends on the scar. So you know, if as an example, I had a client who has a linear scar down his face. It was relatively new. I started treating with the Pico 8 weeks post the stitches. Sorry, I was going to call them sutures. Post the stitches came out. So I did give the skin a little bit of buffer time. However, I waited the 8 weeks and then started treatment. So it really depends on the type of scar, where it's located. But come in for an assessment as soon as you have the scar, and then we create that treatment plan for you and give you an accurate timeline is really important as well.
Because it takes a while.
Yeah, I think, you know, you don't want to cause trauma to the area if it's still healing in some aspect, however, you know, we can do it sooner than later depending on the situation.
Okay. Awesome. And do you think there's a benefit to doing it sooner rather than later?
Yeah, absolutely. There is certainly a benefit of sooner than later, because obviously your cells are recreating, that collagen is really being stimulated, and that renewal process is in big action mode in regards to repairing and nurturing that particular area. So, you know, doing the treatment earlier is good because we can further help stimulate and further speed up that healing rather than leaving it too late.
Okay,
excellent.
Awesome.
Thanks, Carolyn.
Yeah, thanks for your question. So we have another one. How long do scars take to fade? Now, I'm not sure if you were asking how long they take to fade in general or once the treatment starts, but maybe should we talk about both a little bit?
Yeah, sure. So in regards to how long do scars take to fade, once again, it's sorry to keep moving everyone, it is slightly variable. I always am honest with my clients. So I generally say, and let me clarify, when you're saying how long do scars take to fade, I'm assuming that it's from that, you know, vascularity red phase to then trickling through into more of a lighter or skin color. I generally say 1 to 5 years as a holistic ballpark figure. I know it's quite variable. However, the body takes longer to heal than, for example, the face. So once again, it comes down to location, which is a really fun fact, but 1 to 5 years for it to fade. And sorry, Erin, the other part of your question there was in regards to treatment results?
In terms of treatment, if you start treating it as soon as you can, how long does it usually take to fade once you've started your course of treatment?
Sure. Good question. I usually say to my clients that it is a cumulative result. So I'm not going to be able to provide a wow factor result just from one, depending on the scar. So we generally, as I said before, recommend to our clients 6 to 10 treatments depending on the type of scar, the depth of the scar, where the scar's located. I usually do a revision. I take a photo documentation for our clients. I do a revision of halfway through, have a reassessment. So I would always say that you will see changes, but it will take time. So at least 3 treatments to start seeing some result, and then it's a cumulative result from then onwards.
Okay. Yeah, so it's a bit of a journey.
Oh, absolutely. It definitely is a journey. And once again, it depends on the type of laser that you use. You know, whether it's that CO2 that I was talking about, or whether it's a Fractional, or whether it's a Pico. It depends on the settings that we're using, how much downtime's provided. You know, and however, every treatment does have a journey. Yeah. Especially non-surgical. So. Yeah.
And I guess with people too, I mean, each person's, everybody's on a personal journey, and your scar is a story of a journey. So it's
so true.
Your own journey to...
And there's other lifestyle factors, for example. So I know, leading on to one of our questions, just to skip down.
Oh, this was a good question. Yes,
please.
Are there any food and diet recommendations to help with healing? I don't smoke anymore, so congratulations on quitting, by the way, which will help. But are there any certain foods or diet things that can help?
I think, as I said, describing about my passion, it's really looking at what's happening internally, externally, and how we can support that in combination to treatments. So in regards to food and diet, this is such a big aspect. My biggest tips in regards to food and diet is, first of all, ensuring that you're taking or having as many anti-inflammatories as possible. So you can do that through supplements or antioxidants or through food. Things like even an ingredient known as curcumin is a really strong anti-inflammatory. So it's great for scars, but I also recommend it to my clients that have vascularity or rosacea to help suppress and to calm down internally. Things like probiotics are really important because we know how gut health is extremely linked to our other organs and our skin, such as our skin. So probiotics, absolutely. Lots of water will help with the healing process as well. And a healthy, active lifestyle, I think, is really, really important.
Yeah, so get active, eat your leafy greens.
Absolutely. I think, your lifestyle factors, whether it's alcohol consumption, whether it's smoking, has such a big effect on how our body processes wound healing in itself and healing in general. So I think having a holistic lifestyle, combining your healthy food and diet and being active, in corporation to treatments is the best outcome for our clients.
Awesome. If you're healthy inside, you're healthy outside.
Yes. Thank you.
So now I think we're just about to wrap up, but one of our final questions, do different remedies help with different types of scars?
Right. I was doing a little bit of research on at-home remedies that people have spoken about in the industry, I guess. And a couple of those, coconut oil, I think we were talking about, there was bicarb soda that came up as well that I was reading earlier today. I think the best home remedy is, once again, putting out any aggravation around a scar. And if you are going to do something at home, I guess, the best thing possibly, yes, my top one would be aloe vera. However, as we know, aloe vera is extremely calming, and that will take out any inflammation to the area or the scar. However, I truly, hand on heart, believe, an at-home remedy will not treat the scar alone. You need to be using those products that we've been speaking about. You need to use a form of laser. Once again, products are only more epidermal. We need to travel down into the dermal structure of the skin to stimulate that collagen network or that protein network to improve the scar integrity and the skin integrity. So I truly believe that remedies can be used, but there's lots of other things that I think are going to get a better result for the client.
Okay. Awesome. Yes. So we have a couple minutes left. Does anybody have any more questions? If you want to clear anything up, send it through. I believe we'll also have Trish said she would also post a video for this. So if you want to, of this live, so if you want to go over anything again. Sorry? No.
I think the biggest question that I get, I was just thinking about questions that my clients usually ask me, is probably pain threshold. Are they, we covered this slightly before, how painful are these procedures or the treatments, and everyone's pain threshold is slightly differently. However, with the Pico, for example, we do offer our clients, in some cases, a topical numbing cream to make them feel more comfortable. We also have cold air going over the area, so it's mixing the senses as well. So it's not something that our clients or patients should be concerned about. We're here to help you and get you the best results and create provide a therapeutic setting. However, the best possible way that I can describe our Pico laser for scar repair is like a a vibration or a little tapping sensation over the skin, similar to even kind of like even an electrical current, like a pins and needles.
Pins and needles.
Yeah, I think so. It's
like a tingling almost.
Yeah, like a tingling sensation. Once again, it's not a photothermal laser like our Fractional or our CO2s, because it's photoacoustic. So that's why I try and explain it like a little tapping or a pins and needles sensation traveling over the skin. I think that's my most common question asked.
I think with some of the other laser treatments I've tried, I would say that's similar, like kind of a tapping, warm type of feeling.
Yeah, absolutely. I think so.
All right, awesome. Thank you so much, everyone, for watching and for getting involved. And again, if you have any more questions, we also offer complimentary consultations because, as Annie said, it's really important each scar is unique. It's important to get them assessed before you can get all the right information on what works specifically for you.
Yes.
So yeah, please visit our website. It's rejuveaustralia.com.au, and you can also contact us on social media at Rejuve Australia, and we hope to talk to all of you again soon.
Thank you. Thank you, everyone. I really appreciate it. I hope I answered all of your questions, and I hope to see you in the clinic in the near future. Thank you.
Thank you. Have a great night.
Everyone.
Bye.
See you later.